It's a brand new strain of influenza, an ever-morphing mix of gene sequences from swine, bird, and human flus. It attacks the young and the healthy, and it kills quickly. Health and emergency measures organizations across North America have sprung to red alert. As many as 60 people are dead so far, 1,000+ cases identified, mostly in Mexico. The government has closed schools, banned public events, and begun mass immunization. The Centers for Disease Control in the U.S. say it's already too late for containment measures, with new cases identified in Texas and California. We have extensive coverage, beginning with Joanna Remiliotis. Joanna?
Harry, there are still a lot of questions out there about this mystery virus. As the day wore on, more cases of a deadly flu virus were confirmed in Mexico. And as the numbers went up, so did a sense of alarm. Classes for millions of children were canceled. In what is shaping up to be a migrating virus, 60 deaths in Mexico have been linked to a strain of swine flu, also identified in 8 people in California and Texas. U.S. health officials are not calling this a pandemic, but the signs of an emerging pattern are there.
We do not know whether this swine flu virus or some other influenza virus will lead to the next pandemic. However, scientists around the world continue to monitor the virus and take its threat seriously.
The link between the outbreaks in Mexico and the U.S. was made at Canada's top laboratory in Winnipeg, after experts analyzed several samples from Mexico. So far, no cases have been reported in Canada.
Mexico, Texas, California.
But there are still a lot of questions. World health officials are on high alert. Teams have been sent to Mexico to determine the source of the outbreak and to try to explain why many of the dead in Mexico were previously healthy young adults between 25 and 44 years old.
The fact that these are happening so late in the influenza season and that many of the people affected are young adults rather than young children or older people has raised alarm bells for us.
The American patients responded to current antiviral drugs and are all doing well. Canada has a ready supply of antivirals too, and may have to use it. Given the volume of travel between Canada and Mexico, about 650,000 Canadians go back and forth every year, experts say it will only be a matter of time before the virus appears in Canada too.
It would be naive for us to say that what's happening in Mexico will not go anywhere else, or that what's happening in California won't go anywhere else. Given that we know this is influenza, influenza always goes somewhere else.
Public health officials say they are learning more about the virus and how it's spreading every day. And while at this point this is not a pandemic, that could change very quickly. Harry?
All right, Joanna, thanks very much. The CBC's Joanna Remiliotis.